What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Bryan. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Doing good. Hey, everybody. Thanks for being on with us. Today, we're talking about something that I've certainly seen a lot of in my practice as an acupuncturist, and that is trigger finger.
Yes.
Also
known as,
Go ahead.
Stenosing Flexor Tenosynovitis.
Yes.
We'll stick with trigger finger.
Yes. So what is it, Bryan, exactly? Like when people say they have trigger finger, what are they talking about there?
Well, it seems like most of the time that, first off, the person's going to have pain, and it can start with like an audible clicking or popping that the person hears when they flex their finger. So we're thinking of pulling the trigger, aka trigger finger.
Right.
So when you flex the finger, and it can start without pain, and you'll have that audible clicking or popping, which is the tendon that runs underneath a series of sheaths and pulleys that help keep it in place to the bone. And it's basically becoming either dislodged, or there's a nodule or some sort of inflammation in there that is disrupting the normal mechanical movement of that tendon with finger flexion. So the person may be unable to actually extend their finger and could get it stuck in flexion.
Right. So if I have my finger here and I bend it, you may get pop and get stuck there. And a lot of people have to like bend it back, which can be painful. And it can happen to any of the fingers, right?
Yeah, from what I know, it can happen to any of the fingers, but I definitely saw a commonality just in preparing for the podcast in the ring finger more so.
Oh, okay.
I don't know if you've seen that in practice.
Yeah,
I'm excited for this conversation specifically because I obviously know about this from school, but I've yet to actually see it. And you've seen it quite a bit. So I think it's
right. I've seen it in the ring finger. I've seen it in the thumb.
Okay.
I've seen it in all of them. I've seen people have more than one trigger finger. I've had people who, they in the morning their fingers, they have to like work them. They're like pop into place and they have to like bend them back, all of them. Usually it's just one.
Mm-hmm.
And usually it comes on after repetitive type movement that they've done with their hand where it gets kind of inflamed. And when you're talking about the pulleys, right, we're talking about the pulleys across here, right?
Yeah, there's quite a few. I mean, I'm not a hand therapist.
These are the main ones we're talking about, right? Like
for trigger finger, yeah.
1 through 5, I think that's right.
They actually travel up the numbers, I'm pretty sure.
Oh, they travel up the finger. That's right, right. Mm-hmm. But this is the area right here that seems to be the biggest problem, these pulley areas in here.
Yeah, so if you're just listening, basically if you just bend your fingers, and this will be great if you can hop on the YouTube, which we've got a link in the show notes if you want to just click over there. But if you just bend your fingers without curling them, and you just bend right at the knuckle where you would kind of punch someone, I guess, that is where that A1 pulley, which tends to continue to come up with trigger finger, is located. So we're really talking towards the base of your finger.
Okay. And so it's A1 up to A5?
Yeah. If I'm correct. Yeah. And then you have even cruciform pulleys. So you have C1, C2, C3. The hand's very unique.
Oh yeah. It's incredibly complicated. Yeah.
But long story short, you have those pulleys that help keep the tendon down that is flexing your finger. So if something goes wrong in that sheath, or you have less space to work or anything like that, it could certainly disrupt movement. And that's what we're talking about here.
Yeah. Okay. So this condition is defined many times as more of an inflammatory type condition, right? And so with certain disorders, diseases like diabetes, you may have more of an incidence of it.
Yeah. I mean, certainly with the tenosynovitis, like in the name, it helps cue inflammation.
Yeah, the itis, inflammation, right?
Yeah. But I have seen that it's not due to inflammation. And then a lot of times I've seen that's really quite idiopathic.
Okay.
So I don't know if you've seen that or not, Keoni, but it can certainly be an overuse injury. Thinking of someone who started clipping their hedges and just has been doing that all weekend, or maybe they start a new landscaping job and that's a big part of it. And we see it a lot, at least within physical therapy, of people who are, it's like occupational related.
Okay.
So if you're doing something all day that requires you to do that, you're definitely more likely to do it. But it certainly can come with inflammation. I've heard of nodules that can develop on the tendon, and this
I've
would come.
definitely seen that.
And
You
you've
can
seen
see
those?
that, and you can palpate those. Yeah.
And so with those, that would obviously just close that space and create a disruption in the normal movement. And you can certainly have inflammation of either the tendon, the actual tendon going under there, the A1 pulley that's on top that could close the space down, anywhere near there. So if you have inflammation there, it could certainly disrupt it.
Right. Okay. So for me, when I actually see patients with this, it's usually they've tried everything else, and then they come to me, and then they try acupuncture. So I use acupuncture quite a bit, and I use natural anti-inflammatories quite a bit for it, which seems to help. But typically with this condition is, for most people, it tends to go away. So it tends to go away on its own. But if it's still there for more than a month or two, then definitely need to get, other treatment. It rarely will require surgery, although I know that's one of the things that
Yeah.
one of the conventional treatments.
You said you've seen it in the thumb. What type of, have you always seen it in an older patient, Keoni?
No, I've seen it across the board. Doesn't necessarily have to be older. I would say, yeah, probably I've seen it more in women than men.
Yeah.
And I've seen, I don't know, I guess there's a higher prevalence in middle aged and older, but I've seen it in younger people too.
Okay. Yeah. Yeah, I know it's like you mentioned, it is more common in women, the studies say. And then you also have, which you mentioned this as well, diabetes and other related disorders. So if you have anything with your hand already, you may be slightly predisposed to trigger finger. We're thinking like a tight wrist joint capsule, any tightness within the hand, carpal tunnel syndrome. This is further down the chain, but it could certainly impact your ability to maneuver in that small space. And then that goes back to the inflammation or the nodule. If you narrow that small space, it's pretty clear why we have a problem.
Right. So those other disorders may be like rheumatoid arthritis, maybe gout, anything that can cause the joint capsule to be inflamed.
Keoni, did anyone report like a traumatic event that you saw?
I've had some people, not so much where, like they had like extreme trauma to the hand. I haven't really seen that. I've seen stuff like I was working all day in my yard, went to bed, and the next day I couldn't straighten my fingers.
Yeah, so that's perfect. That's exactly, at least from the reading and what I've learned, is what we see. We see it's not necessarily something, a particular event happens, a traumatic event happens, and then you have this problem. It's something just like you mentioned, where the person was gardening all day yesterday, seemed fine. Maybe they didn't even hear the audible clicking as they were buzzing around the garden, having a great time. And then the next day, they have an inability to fully extend the fingers.
Right. So how do you guys go about treating it, Bryan? Like, what do you guys do?
Yeah, so you definitely have to, and physical therapy is a big part of like treating the impairments. Like we may know what's wrong, but what's the actual problem? And that's like your inability to move, that sort of thing. So we can start, obviously, and you mentioned this, of treating the inflammation. So non-steroidal anti-inflammatories, and then we know some of our more natural options would be curcumin, and then what other ones, Keoni?
So I think fish oil is a good one. Think about oiling the joints, right, so they can move more freely. That can help. You're not going to see a wow factor by taking those though right away. You're going to have to take them for a couple of weeks, and then you especially if the main cause is inflammation, then you'll see some improvement there. But yes, the NSAIDs, curcumin, boswellia, ginger, fish oil, all that certainly can help. Some of your anti-inflammatory enzymes, high dose taken between meals, bromelain, certainly can help.
So we would certainly start there, because those things are going to help quell that inflammation if you have it and create more space. So we want to start there. And then from there, we would really work on stretching the finger, the tendon, working in that space. And we can even do splinting, which has moderate evidence to it from what I've seen, where you would splint either overnight or just long-term, helping to keep that finger extended. Because often what I've seen in the reading is a patient, like you mentioned, Keoni, who was gardening all day the day before. They're just going to wake up with that problem now. It happened overnight to them while they were sleeping. So a splint can certainly help with that. And then we've talked about the nodule. So we would certainly do like cross friction massage to that A1 pulley or that area. And that just basically means cross friction means fibers are running in a direction. Let's just think of a cable, like a cord. You see the little fibers of the cord running in one direction. You're going to friction across the cord. So you're going perpendicular to the way that.
So if you're looking at the hand, the fibers are running this way, right?
Yeah.
So that's another treatment I do when we get into the traditional Chinese medicine is you do gua sha, where you take an instrument and scrape across that nodule.
Yep.
That can really help. So, and we talked about cross friction fiber, like massage and stuff, with a number of injuries in the past, and it's really a good thing. Seems to help quite a bit.
Yeah, I correct me if I'm wrong, because I definitely need to read more up on it. But you're essentially trying to stimulate a small inflammatory process to help clear out that area and get it rebuild correctly.
Yeah, that's I think a good way to say it. I mean, it may be hard to wrap your head around that, but whenever you create a small amount of inflammation in an area, it's almost like it wakes up the body to increase blood flow and oxygen flow, comes there, cleans out the debris, so to speak, brings in the good stuff to help repair. And so with acupuncture, we do the same thing. So here's your A1 pulley right here. I would needle on either side of that pulley. So here, and then
so you're needling at the site of the pulley. Is that
I'm gonna needle at the site of the pulley, and then I'll probably do some points. Like I'll needle into the pulley, but I'll also needle like right here. I'll needle right here. I may even come here and needle on either side of the hand.
The exact locations you're pointing at on the palm specifically are pretty much where they would inject cortisone. So that was another treatment, another option. But that's where they would inject cortisone, exactly where Keoni's putting those needles. And that makes sense to me because with dry needling, for physical therapists, we think of essentially doing cross-friction massage, but almost to a more intense level. Essentially, we're trying to have that same outcome.
And if you're dry needling, are you needling the same area?
Honestly, I don't know. I don't know enough about dry needling.
Because I think, and I don't either, to be honest with you, but dry needling, from what I understand, is more like medical acupuncture, where you needle the site of the problem.
Yes.
Right.
Yeah, that I can confirm.
Right. And I'm also doing that with acupuncture, but I'm also using points like here and then down below the knee. These are points that are known in theory to help stimulate, promote the flow of qi and blood. Anytime you have like stagnation or whatever, a finger stuck, that means stagnation, you would want to promote the control, of qi and blood, get the qi flowing smoothly so that you can move your fingers freely. And then you would also want to treat locally. Man. So, and that's why dry needling is probably just as good as like acupuncture here. It's more like a medical acupuncture type thing. So, and I don't know much about it. We probably should get a dry needle expert on here.
I hope to be one day.
Okay. Well, so I think you're going to need, definitely, like you said, needle the site of injury there.
That makes sense. Yeah. What I love about this already is just we talked about cross friction massage, your acupuncture, my dry needling, and at the end of the day, with all the different schools of thought, we're going for the same goal, which is to help stimulate proper healing of that area. And when we talk about cross friction massage, I thought you did a great breakdown of it. But as a physical therapist, it's really about load management. And so just to keep going with the cross friction massage, you get that area to stimulate the healing process. And then we, as a physical therapist, facilitate proper healing. So when you have like a tendon dysfunction or like a tendonitis or something like that, your tendon, if it's a tendinosis or tendonitis, is a huge debate, but the tendon is in dysfunction and it could repair on top of itself, not necessarily correctly. And what we want to do is break that down with cross friction massage, which we're doing to this trigger finger A1 pulley. And then we're facilitating proper healing of those tissues and how they're supposed to work to allow for that proper gliding.
Right.
And the exact same thing with the acupuncture.
And that may be why some people, it doesn't go away on its own, where, you're laying down fibrotic tissue in here that's actually can make it worse without that cross-fiction rub.
Right.
So yeah, so it's something that you want to start treating right away. And a lot of these treatments, you can do this cross-friction rub.
You could do that by yourself.
Yeah, you do it at home.
Yeah. And then other conservative treatments. So I mentioned kind of treating impairments. So we know that we're having difficulty extending our fingers. So what you can do is get a rubber band, or even on Amazon, I don't have it right next to me, but they have like hand
I've seen those things.
Exercise tools. So basically you would take a rubber band, put it on the outside of your hand, and open your hand powerfully, and you're going to help build the extensor.
Yeah, so you're working those extensors, here.
So you're just making the other side of the hand that would pull it open a little stronger. Now, is that directly treating the problem? Not necessarily, but is it treating the impairment that you may have of not being able to open your hand? Yes.
Right.
So we would definitely want to strengthen those extensors and basically stretch, massage, anything to that flexor group. Now we're talking about the trigger finger problem, the actual flexor tendons. So we want to stretch those out, massage those out, work through active and passive range of motion once we have full range of motion, hopefully.
Mm-hmm.
And then from there, if they continue to have pain, that's where we start talking about cortisone shots or possibly surgery.
Right. And those cortisone shots, that's a big needle in that area. They're not fun to get, especially in that area at the A1 pulley. I've had people get them and actually say it made it worse.
Oh, wow.
It got initially it felt better, but then over time it made it worse. And you certainly don't want to depend on cortisone shots. You want to try to do the natural stuff first, because for one thing, too much cortisone can ruin the joints and create more of a problem.
Yep, absolutely.
So surgery, cortisone shots definitely should be your last resort.
Yeah, and surgery, what they're doing is they're going up and they're cutting that A1 pulley. So you got that tendon sheath, and it blends with all these pulleys, A1 through A5, C1 through C3, and they're going to go in there and just snip that A1 pulley.
So they're snipping it. So now you have a broken A1 pulley, right?
Yeah, plenty of free space. Solve the problem.
But it makes me wonder, do you know, so if you do that, the body's going to want to heal somehow. So I just tend to think, now is the body going to lay down more scar tissue and then over time make it worse? I'm not sure about that.
That's a great point.
The surgery surgery in itself, you're always adding an element of complication possibly, right?
Absolutely.
And you want to do the best that you can to avoid that.
Absolutely. As far as keeping track of your improvement, obviously you're going to know if you can open up your hand and that sort of thing. But one thing that I think is just not as commonly used is just grip strength. So if your grip strength should match on both hands. Maybe you have a little bit more strength in the dominant one, but using that as a way to see if you're truly getting better is like an outcome measure. It's monitoring that grip strength and monitoring your pain. And then of course your range of motion within that finger. Do you hear an audible clicking or popping? Or do you ever have any time where you have to feel like you have to forcibly bring your finger back? And you mentioned that people often will bring their finger back straight, and that's how you're going to have to do it. But typically there's no problem doing that. So the person will have no problem necessarily straightening their finger out passively. It's more of
passively. They can do it on their own instead of taking their other hand and straighten out their finger, which is usually where they get a lot. When you have to straighten out your finger, most of my patients, that's where they get most of their pain, when they have to
fully straighten it out.
Yeah. So it can be an issue there. But it's one of those things that if you know what you're doing, should be easy to treat. And so for me, typically once we get started, it usually takes like 2 or 3 acupuncture treatments. And of course, and when I say acupuncture treatments, we're needling, we're doing the cross-friction massage to the nodule area, and then I'm using some sort of anti-inflammatory. So in my treatment, I usually give them all of that, and usually probably within 2 to 3 weeks, they're back to normal.
Wow, pain-free.
Yep, usually pain-free, and they're good. They're ready to go on, and it's a shame because many of them come to me and they've already been through the cortisone shots and the NSAIDs and the over-the-counter NSAIDs, but.
Well, I wonder if the cortisone helped them be able to follow through with you, sort of thing. But then you're doing not necessarily active things, cross friction, acupuncture, and then the
Right.
NSAID. So it's not,
Well, so, and a lot of people, yeah, you're right. They get the cortisone shot, and what they're telling me is they have to keep going back and getting it,
Mm-hmm.
you know?
Yeah,
And
I've seen that.
and eventually it doesn't work as well. Now there are some, and I wouldn't see those, but I'm sure there's some who get the shot and everything is, good to go and fine. But I'm seeing the people who've tried all the conventional stuff, and then come to me. So
right. And now, when these people come to you, Keoni, do they ever report that they've done physical therapy?
It's interesting. Most of them don't actually.
Yeah.
That's a shame, right?
Yeah.
Yeah, that's a shame, because really they ought to be doing that first.
Yeah.
Going to their, and that's something that has, well, there's a lot to be said for how ridiculous our system is, right? So you go to the medical doctor and they do all this other stuff where they should be going to a physical therapist first.
Yeah, just different tools. I mean, you even see with, we definitely talked about it in our 4th episode, the healthcare team.
Yeah.
Where it's just you go to the butcher, he is a butcher. You go to the gardener, he's a gardener. You have to go to all these different people to find, if you go to the surgeon, they're going to suggest the surgery.
Right.
Most likely.
Yes, and it's interesting to me. So they go to the conventional treatment, let's say the regular MD, and then they come to me. Whereas really, my treatment's pretty invasive compared to what a PT is going to do. I'm needling into the nodule most of the time,
Yeah.
Whereas a PT is probably not going to do that, and probably not going to do the dry needling right away.
Yeah.
It's just interesting. Like with all this musculoskeletal stuff, which is, in my opinion, is like 95, it seems to, I don't know, I'd love to know the numbers, 90% of most of the medical visits out there, it's like musculoskeletal complaints, right?
Yeah. I know low back pain is like the number one disability in America.
Yeah, so it's always interesting to me, although medical doctors are getting better about referring to PTs, but yeah, it's always interesting to me they're not being referred there first. And a lot of it is, a lot of people don't know.
Yep.
They just think, well, I got to go to my doctor and see what's going on in my hand.
Yep. And I think we definitely talked about that it is kind of inflammatory, or that it could be inflammatory. And I failed to mention, obviously, we want to quell the inflammation. So we talked about steroids, and we talked about NSAIDs, but you certainly use ice or heat depending on the stage.
Yes.
I definitely, in the research, I saw success with people doing wax therapy, which I'm pretty sure paraffin bath, but I could be getting that incorrectly. But basically, you're going to put your hand in a hot thing of wax, pull it out, and it's just going to keep your hand really warm. And it's more like kind of like a warm compress that you're going to wear for 10 or 15 minutes. So ice or heat, depending on where you're at in this stage. If you're the gardener who woke up fresh today and all of a sudden your finger's stuck, probably not the time for heat. But if you've been dealing with this for a more chronic issue, heat may be more optimal. And then heat, we know, increases the extensibility and the mobility of tissues.
Yes.
So it's kind of a fine balance that we're trying to play, because we know it's inflamed, so we don't want to add heat to make it more inflamed, but we know that heat has all these great benefits. So we need to just use it at the right time. Yeah,
you think about acute versus chronic. More chronic conditions are using heat. And I'm glad you brought up the heat, because part of my treatment, I also use moxibustion, right? Which is a Chinese herbal heat therapy. And of course, it depends on what we call the Chinese diagnosis, but certain diagnoses require heat treatment. And so I'll use moxibustion over the area, usually the A1 pulley area, to help free motion, help the fingers move freely.
And it would be great to use that heat before doing your splinting or your stretching exercises, because you've increased the extensibility with that heat, and now you're going to take advantage of that increased extensibility or increased ability to move.
Yeah. Cool.
Anything else that we missed, Keoni?
I don't think so. I guess I'll just mention, I don't know, do you know of any studies out there? I mean, I know with acupuncture, there are some decent studies on trigger finger and just using acupuncture alone. So there are a number of studies out there.
I didn't really find, as far as physical therapy, because I always search within the confines of physical therapy at this point, of just they're using a variety of things. So I saw one study that had 74 patients that were treated for 10 sessions with that wax therapy that I just mentioned,
Okay.
ultrasound, and then the stretching. And it's, 70-ish percent, 68.8, 70% of people had a full resolution of symptoms 6
Right.
months out. So it does seem like conservative therapy should be able to manage it. And at the end of the day, this is something that's, your finger getting stuck is obviously jarring and quite quite freaky. But this isn't, it really depends on how much this is impacting your life as far as what type of treatments you're going to choose. I wouldn't choose surgery until it's like, man, I can't go to work because I can't open my hand to do typing on the keyboard or whatever the case may be. So there's definitely a order of operations like we always preach. And it should start with the more conservative therapy and continue with the conservative therapy until you know for sure that's not getting you the results you need.
Yes. Yeah. The least invasive therapy to the most invasive therapy should be your therapeutic order on any of this. And of course it depends on, like you said, how much it's impacting your quality of life.
Boom.
So, yeah.
The tendons are flexor digitorum profundus and the flexor digitorum superficialis. Those are the ones that flex your finger. So there you go.
Yes.
All
right. I forgot all those words back in my school days. Okay, good. You guys remember that. Flexor digitorum profundus, flexor digitorum superficialis. You can tell your doctor
next week.
Yeah, that's right.
All right, everybody. Did we leave anything out, Keoni?
I don't think so. I mean, I think we hit on all the main points. So it's great.
All right. Well, we will speak with you guys next week. Looking forward to it.
Yeah. Take care, guys.